So today we're talking with Josh Hough, who is the MD and co-founder of CareLineLive, which is an award-winning all-in-one home care management system that helps home care agencies improve efficiency, capacity, and provide better care. So Josh, welcome to Care Radio. Thank you for joining me today.
Thanks very much for having me.
Tell us a little bit more about you, how you came to do this and how you became the MD of CareLineLive.
Sure. So it kind of started for me in a sort of like two different ways, really. So firstly, I was running an IT business and we were working with a home care agency, and they said that they'd like to better manage their remote workforce, basically. So kind of using the technical information that I had and my understanding of different technologies and stuff, what I was able to do was look at the competitor systems or what was available on the market at the time and understand actually how we could improve on it and what sort of things we could do better that made it more efficient and easier for the carers to use, but also for the management team themselves. But whilst that was going on, my family or my grandfathers were both receiving home care or have done ever since slightly different times. And so looking back at that, what I was able to look at was, the frustration around the information that we had as relatives when you're a 2.5, 3 hour drive away, and actually what you'd like to see more of. So suddenly what actually I realized was it's really important that we kind of connect that circle of care. So between, the service user or the patient, the family and friends, the next of kin, the stakeholders such as GPs, that sort of stuff, and also then the management team themselves. How can you pull all of those people and the carers together to get something better? And that's kind of how I sort of fell into this, if you like. When I was a child, I would not have expected to be running a business that makes care software, but here we are, and it's really good fun.
And what's your technical background? How did you get to that position to be able to come up with such a brilliant idea?
Throughout my kind of school career, I was really, I don't know if you would really class school as a career, but throughout that I was always interested in technology, and so computing lessons and that sort of stuff was really like what I enjoyed and what I got into. But what I did realize is that whilst I am capable of programming and whilst I'm a technical person, if you like, more of what my understanding is actually how we can apply technology to make something better and how we can demonstrate that to people and how it can make efficiencies for those people using it, rather than the actual programming it myself. That kind of wasn't really my forte as such. So I guess you would say I'm more of the business head as opposed to the technical guy, if you like. Although I understand it and I can make it work, I wouldn't necessarily write it myself.
Okay, so explain in layman's terms how this actually works, how from start to finish, how this product works.
Okay, so basically what we've done is we've built an entirely cloud-based management system that allows an agency to run their whole business. So what we do is we deal with the scheduling, the invoicing, and the payroll. So management can sit there and do the things that they need to do, and we can automate some of those processes. We also then take the patient welfare aspects of that and we deliver that to the carer on their device. So the carer has a phone with an app. They're able to scan when they arrive, scan when they leave. We take all the information that we need to about their arrival and departure time, and we send that to our cloud server. And then the carer has, at the touch of their fingertips, the tasks that they're supposed to be doing, the medication they're meant to be administering. They can raise incidents as well, which run through their CQC's key lines of inquiry as well. So it's fully kind of formulated to make sure that we're getting the right output out of that. And then again, all of that goes back to management. So management can sit there, they can look at actually, whether fluid intake has increased, whether catheter output has decreased, for example. They can look at the nutrition and they can analyze all of that information on the dashboard in near real time. So suddenly what you've got is, if a service user refuses to take a medication that may be life-threatening, what you've now got is those safeguarding concerns being resolved much faster than you would have had in paper-based scenarios where it may not have been dealt with.
And I can see that this is going to massively affect and improve, I guess, job satisfaction for carers, feeling that they've got some sort of backup system that enables them to do their jobs more efficiently.
I would always hope so. As with every kind of business process, change management is the most challenging part of integrating a system like this. You've got carers who, for them, they do the job because they want to feel like they're looking after people. They want to feel like they're doing something good. And so you'll sometimes feel like you're putting something in the way, that's another thing to do. It's another process, it's another procedure. But actually, ultimately, it's protecting them because it's evidencing that they've done what they should be supposed to do. They can take pictures and they can upload them and stuff like that. So they've got a real evidence there. It's better for the service user, so they should get satisfaction out of that. And it gives them more security over what they're getting paid. We're dealing with a sector that, whilst we don't necessarily want it to be like this, is very much on a 0-hour type contract. And so it's really important for these people to get paid for the work that they've done. And by using a platform like ours, we make sure that that happens.
Where do you think in the past, we, in your opinion, that we've gone wrong in the care sector in terms of that level of support for carers? So even like you're saying, you hope that this is going to affect their overall job satisfaction and hopefully their mental health and all that. But where do you think in previous years we've gone wrong in not giving that level of support to carers?
I think it's hard to do this without kind of going too political and not sitting on the fence there. I don't kind of want to try and side with anyone, but I think the issue that we've got is the sector doesn't necessarily receive enough recognition to start with from the state. We know about the severe pressures on that sector. We know about the severe pressures in terms of how much they get paid and also their costs as well. They all drive cars, or most of them drive cars and stuff. So, that it's quite expensive for them to be in this kind of line of work. And I think that's one thing that I do think has gone wrong, because I think, because we've not recognised the sector feels underappreciated. And as a result of that, they struggle financially, they obviously struggle, and the state can't necessarily meet those expectations because of the way the budgets have run in the past. So I think that's one thing. CAP Carers was a great thing that came out, and I think started to make a bit of a difference. But the key thing there was the messaging was still very much on, while it's more about NHS and care homes than it was necessarily about the home care workers, who are arguably, as the sector's grown because less people want to be in care homes, arguably it needs to be even more appreciated than they have. I mean, they still needed to be appreciated more, but even more so than pre-COVID, if you like. So I think that's really where I think the issues have stemmed from. And I hope that as we see the sector continue to increase, I mean, ultimately, it is cheaper for the government to look after people in their own homes than it is to look after people in care homes. So also with COVID, if I look now, would I want to put my family in a care home? Well, no, I'd rather they were looked after in their own home. So I really hope that actually the continued growth of this is going to improve those things even further in the recognition and that sort of stuff.
I think it will, because I think it's just, by the sounds of it, such a massive support, because suddenly it's not about the carer being accountable, it's about the carer being able to share what they're experiencing as they care for someone else.
Yes.
And gaining recognition as well, I guess, from their managers at the same time for dealing with lots of different types of situations, I suppose. And that leads me on to my next question about how you feel technology in the future now, better technology in these sorts of cases, will help and support people's mental health, because that's another massive thing that we've learned over care and the pandemic, is that people's mental health, particularly carers, have suffered massively.
Yeah, so I think typically it's always been a sector that, whilst they work with people, can feel quite isolating because they're not necessarily engaging with colleagues ever. Yes, they're seeing their patients or their service users, maybe sort of 10 different people a day, and that's great. You can have some good conversations, but you still don't necessarily build up that kind of, you're part of a team, but you don't necessarily build up that teamwork and that rapport with somebody because you're very distant from them most of the time. I think by putting in things like, the office are able to push announcements out through our application, so the carers can be made aware that a shift is available or something like that. That makes them feel closer. I think the fact that the notes that they write in the app are viewable on the family portal means that actually they know that they're potentially talking to somebody else. That's not necessarily going to help their mental health, but I think the stress and anxiety maybe for some of these people around written English and stuff like that, by allowing them to talk notes into the app and it converting them from speech to text, I think takes pressures off as well. So whilst they're maybe making a sandwich for the service user, for example, they can actually speak their notes into the app. That's really useful because it takes off the pressure from them as they go to leave, having to write the notes in the book. So I think that will help them, and just kind of making them feel close. When they're looking at the app, they can see they've got double up care, they can see who else is there. So again, there's less anxiety. They can read care packages and stuff before they go into somewhere. So the workforce should be safer. If you open the door and suddenly there's 3 steps down, you need to be aware of that before you go in. So those little things, again, just mean that they're safer, they feel safer, their workload is maybe automated in a bit more, so the process becomes easier.
Yeah, excellent. What do you think the future of technology is within the care sector and the NHS, for example?
I think as people move, as I said earlier, move away from care homes to home care and reablement and stuff out of hospitals and things, we're going to have to look more at how we can support people in their own home better. So that would be things like I see through different wearable technologies, different environment sensors, and this whole kind of Internet of Things or IoT kind of network. So, it's things like, actually, can I sit here as a next of kin, for example, and turn my parents' heating on through an app where I can also see the care notes, for example, where I can also see that the door is properly locked. Little things like that start to build up a bigger picture within one app that makes it one kind of single source of truth for people. And I think technologies and increasing that technology is going to have a massive part to do that. If we know that we can discharge patients from hospital safer and earlier back to their own life and own property where they're happier, they're going to get a better satisfaction out of it. The NHS will reduce costs, and we can bridge that together by using some of the technology that you might get in a hospital and lots of stuff and pulling it all into one thing. So I think that network is going to become the most important thing.
And I guess you've partly answered my question, but what's next for your product? How do you see that developing now in the coming months and years as technology changes generally?
A technology company has a roadmap that never stops and never continues, in evolving. What I believe we'll start looking at is more of those integrations, more of those IoT kind of things, more of those sensors, more of those insights, and potentially looking at some AI or some machine learning to actually work on predictive outcomes and things. We're walking a very fine line between making sure that we give all of the information that we need to, but without becoming a medical device ourselves, which is something that nobody really wants to have the headache of doing. But if we can balance that right, then we can continue to evolve in a really strong way for our customers and really support the sector.
Excellent. I'm sure you will. If anybody's listening now, because we get a lot of people that manage care homes, that manage care in the community, how can they find out more about your CareLineLive?
So you can just go to www.carelinelive.com, or you can give us a call on the number on the website as well. We've got a really good sales team who will happily kind of work through, discuss what your requirements are, understand about your business, and kind of show you the real value and how we can help you, and what that means for everybody involved. There's absolutely no obligation. takes, kind of 45 minutes to an hour of your time just to have a look. And then we'll also, if you choose to move forward with us, we'll always make sure that we're continuing to support you or support your business in every single way that we can.
That's brilliant, Josh. And as Care Radio, we are here as a support to carers, paid carers, unpaid carers, NHS staff. I think this is just a great way forward in acknowledging the support and help that a lot of carers do need. And I think, this is hopefully the first step now in developing more technologies that are going to help carers into the future as well.
Thank you, and I hope so as well.
Thank you, Josh.